your doctor is recommending surgery for mesothelioma, you need to have a real conversation about risks. That doesn't mean a reassuring overview that glosses over the hard parts, but an honest discussion grounded in actual data. What the numbers show about the chances of serious complications, what the evidence says about long-term survival, and how you weigh all of that against the potential benefits of going through with the operation. That kind of honest, informed conversation is your right as a patient. And today I want to give you the foundation for having it. I'm Terri Oppenheimer. I've been writing about mesothelioma and asbestos for the website mesothelioma.net for over a decade. I'm not a doctor, and this is not medical advice. But today I want to walk you through what the evidence actually says about mesothelioma surgery risks and long-term outcomes, clearly, completely, and without softening the parts that are difficult to hear. Because I believe that you're better served by having the full picture. Now, before we get into the numbers, I want to make sure we're talking about the same procedures, because there are two very different surgeries used to treat pleural mesothelioma, and their risk profiles are not the same. Pleurectomy decortication, or PD, is a lung-sparing surgery that removes the pleural lining and visible tumors while leaving the lung intact. Extrapleural pneumonectomy, or EPP, is a far more extensive operation that removes the entire affected lung, the pleural lining, part of the diaphragm, and often the pericardium too. These are not equivalent procedures in terms of their scope, their recovery, or their risks. Understanding the difference is essential context for everything else I'm about to share. Perioperative mortality, which means death that occurs during surgery or in the period immediately after, is a real and serious risk with mesothelioma surgery. And every patient considering it deserves to know the numbers. For PD, published research shows perioperative mortality rates generally ranging from about 1 to 7%, with the lower end of that range consistently achieved at high-volume centers, with the operation being performed by surgeons who specialize in mesothelioma. For EPP, the percentages are higher. Published rates range from approximately 3% to over 12%, with some older statistics even above that. We have reported that in some research, up to 15% of EPP surgeries have resulted in death. A major study published in the European Respiratory Journal analyzed thousands of mesothelioma surgeries performed over 2 decades, and they reached a significant conclusion. PD provides equivalent 1 to 5 year survival results to EPP while carrying lower perioperative mortality and better median overall survival. That's a central reason why the field has moved strongly toward PD at most major centers, and why many mesothelioma specialists today rarely perform EPP. Now, I'm going to take a break here to ask you a quick favor. If you find these videos helpful, please hit the like and subscribe buttons below. It makes it easier for other people who need this information to find us. Also, if you have questions or there's a topic you'd like to see addressed in a future video, send me a note in the comment section. And make sure you watch until the end, because I'm going to give you valuable information on where to find resources that will make a real difference for you. Now, going beyond mortality, there's what physicians call morbidity. That means serious complications that fall short of death but still significantly affect recovery and quality of life. For PD, published complication rates range widely from roughly 6% to 55%, depending on what's being measured and how broadly complications are defined. For EPP, the range runs from about 10% to over 80% in some published reports. The most common serious complications after major mesothelioma surgery include prolonged air leaks, pneumonia, atrial fibrillation, which is an irregular heart rhythm that's particularly common after procedures involving the chest, bleeding, and infection. Data has indicated that about 1 in 3 who undergo the most extensive surgeries will experience at least one serious complication, Now, I want to be clear that sharing these numbers is not meant to scare you away from surgery. It's meant to ensure you go in with honest expectations and a strong support system, which is what you deserve. Now, let's talk about the long-term picture, which is where things become more nuanced and in some ways more encouraging. Mesothelioma surgery doesn't cure the disease, and being honest about that is important. But what surgery can do, particularly when combined with chemotherapy, radiation, or immunotherapy as part of a coordinated multimodal treatment approach, is extend survival and meaningfully improve quality of life by reducing the pain, the breathing difficulty, and the physical limitations that this disease imposes. Median survival after PD in published studies ranges from roughly 8 to 32 months, with results at specialized high-volume centers tending toward the higher end of that range. For carefully selected patients with the most favorable disease characteristics, outcomes can be even more encouraging. One study found that patients treated with PD combined with chemotherapy achieved a 5-year survival rate of 67%. Now, that figure is exceptional, but it illustrates what's genuinely possible when all the conditions align. Several factors consistently predict better outcomes, and knowing them can help you ask your surgical team better questions. Cell type is among the most powerful predictor. Epithelioid mesothelioma responds far better to surgery than sarcomatoid or biphasic types, and most specialized centers won't recommend aggressive resection surgery for patients with sarcomatoid disease. Stage matters, as does functional status and lung and cardiac function. And perhaps most practically, where you have surgery matters enormous. The evidence is consistent and clear. Patients who are treated at centers with high volumes of mesothelioma cases by surgeons who specialize specifically in this disease achieve meaningfully better outcomes than those treated at centers with limited mesothelioma experience. This is one of the most important factors, and you can actually influence it. So it's worth asking about all of this directly. Before you consent to any mesothelioma surgery, I encourage you to ask your surgeon what your center's perioperative mortality rate for the procedure in mesothelioma patients is. Ask what the most likely complications are that you should prepare for, what the data shows for someone with your cell type, your stage, and your overall health. A surgeon who specializes in mesothelioma will expect these questions and welcome them. And if your surgeon seems reluctant to engage with them honestly, that in and of itself is information worth considering. To review, mesothelioma surgery carries real perioperative mortality and morbidity risks that differ significantly between the PD and EPP operations. Long-term outcomes are meaningfully improved when surgery is performed at specialized centers and when disease characteristics favor the surgical approach. And going into these decisions with honest, data-based information is both your right and your best protection. You can visit mesothelioma.net for more information on mesothelioma surgery options and finding specialized surgeons and treatment centers. Or call 1-800-692-8608 or use the live chat feature on our website to speak directly with one of our patient advocates right away. As for me, remember to post your questions below, and I'll see you next time.